Good evening, everyone. I am Preeta Harikrishnan, Deputy Manager of Admissions at Amrita Health Sciences, Kochi campus, and I'll be your host and moderator for this evening. A warm welcome to each of you, and thank you for joining us for today's webinar on the Diploma in Dental Mechanics. We are excited to share valuable insights with you, and we encourage you to actively participate. If you have any questions or comments during the session, please feel free to drop them in the chat box. We'll be addressing them during the doubt clearance segment at the end. Now it's my pleasure to introduce our esteemed guest speaker, Dr. Anna Serene Babu ma'am. Dr. Anna is currently a reader in the Department of Prosthodontics and Crown and Bridge at the Amrita School of Dentistry. She holds both her BDS and MDS degrees from Amrita School of Dentistry, Kochi, and brings with her over a decade of teaching and clinical experience. She's also currently pursuing her PhD in bone regeneration and has authored 12 research publications. Dr. Anna, madam, we are delighted to have you with us today. We look forward to your insights on the scope and opportunities available in the field of dental mechanics, both in India and abroad. Welcome, ma'am, to this webinar.
Thank you, Preeta ma'am. Without much ado, I think we can start off the presentation, right? So,
yes, ma'am.
Is my presentation visible?
Yes, ma'am. Yes.
And I'm audible also, right?
Yes.
Okay. Thank you for that introduction. And as ma'am said, I'm Dr. Anna. I'm a reader in the Department of Prosthodontics. I'm proud to say that I did my BDS and MDS both from Amrita only. And I joined back as a tutor here. And now I'm almost completing my 10th year in teaching. Teaching and both clinical works. So I think and for the last few years, I have been taking this course details to all the young minds who are actually curious to know more about, who have joined and have no idea about dental mechanic course. Is the decision right or wrong? So I'm here to explain to you why you have taken this and where are you going in future. So that I will be explaining here, and no worries, you are in the right track. So this is my topic for today. That is the scope of diploma. Scope of diploma in dental mechanics course. And to start with, I have a small introductory part for those who don't know what is dentistry, don't know much about dentistry. I'm sure that everyone must have gone to a dentist at least once in their lifetime. So dentistry, as you know, it's one of the branches of medicine, and we focus mainly on the teeth, gums, and mouth. That was dentistry, but now it is not like that. Even the outside part, we call it extra oral. That is not only intraoral inside the mouth, we have the rehabilitations or fabrication of prostheses outside the mouth also we are doing. And basically, we dentists, what we do is diagnosis, treatment, and prevention of the oral and dental conditions. So we have so many branches, and the speciality of dentistry is that unlike medical subjects or medical departments, we have a lot of procedures that are happening. And even that is in the first appointment itself. When the patient comes itself, we have a treatment to give them. It is not medicines, or it is not just investigations like x-rays or CBCT. I mean, whatever blood test that we give, we actually go ahead with the treatment first. And for many of the treatments in dentistry, we depend on a technical or laboratory area or people to help us. So they are known as dental technicians. So dentistry is not only dentist, equally important as dentist, we have a dental technician also. So as I told, we have 9 specialities. As from the picture, you don't have to read all the names, and you don't have to learn this. That we learn when you come here. So basically, in layman's term, if I can say, this is basically for correction of the teeth alignment, you have orthodontics. Then if you have a caries or a decay of the tooth, to fill that, to do a root canal treatment, you have endodontics. Then if gum issues are there, you have periodontics for that. Then for children, we have a special department called the pediatric dentistry. Then there is cosmetic dentistry, and what I'm dealing with, or my department, is known as prosthodontics, where we replace missing structures. So this structures involved, as I told, it is not only the intraoral structure, it is not only the tooth or the parts of the intraoral cavity. We have a rehabilitation of the extraoral things also, like even a ear, a nose, or fingers, all that we do. So dentistry is actually wide, the more than you think. So the importance of, coming to the importance of the dental lab technicians in modern dentistry. So what have they? That is the main area of interest today. So who is basically a dental mechanic? A dental mechanic can also be called as a dental laboratory technician. So they manufacture the dental process. As I told you, all these caps, you call it as, we call it bridges, crowns, dentures, and also in layman's term, you can call it caps. You must have seen your grandfathers or grandmothers wearing this set teeth and all. So that all comes under our department. And a dental technician plays a major role in fabrication of these processes. So they work in specialties that include, even not only in prosthodontics, they work in orthodontics, other pedodontics, all other, every department has its own some kind of a processes that a technician has to make. So technician is an integral part, I would say that, of the dentistry. So, and we do the art of creating what God has, recreating what God has created. So God has created something, when you lose it, we recreate it. That's the importance. And we'll just move on to the course highlights. That is what you might be interested in more than, because dental mechanics anyway you are going to learn when you come here. So the course highlights are that diploma, it's basically a diploma course in dental mechanics, and it's a 2-year course after +2. So you might have completed +2 or degree and all. So it's basically a 2-year course. It's a very demanding and remunerative course. So the more details of the course, the administration part, admissions part they'll be dealing with it. But I am just giving you an outline of what is this course. So the basic job of a dental mechanic revolves around assisting a dentist in making dental prostheses. So as I told you, different types of processes, and responsibility to establish better dental care facilities. So curriculum means, in the theory and the practical curriculum, we teach a dental technician about a part of theory also that a dentist should know. So because if the dentist has to communicate with the dental technician, they should definitely know about the theory part also. So we actually teach them a part of the theory also, dental theory also. Then practical, more of practical, but not like BDS course. It is mostly of the practical side, because they have more of lab works to do than diagnosis, or they don't have to go and diagnose the issue from the patient or a problem and treat them. So basically it's practical. So mostly it will be practical, but along with that you need a support of the theory also. So that also we'll be covering. And after the course, a dental mechanic has many job opportunities, which I will be dealing in detail. So this is the course name, Diploma in Dental Mechanics, 2 years. The basic eligibility is +2 with physics, chemistry, biology. It is merit based. So the tuition fee, all that, whatever it is, in detail they'll be dealing with. So I'm not going into that detail. So the job options for this particular job is that either you can work as a dental mechanic. So as I told, you can assist a complete or a set of dentists, and you can work as a dental mechanic, or you can work as a dental hygienist. So that cleaning teeth, that is the hygienist part. So in outside country, I mean India also, there is a huge demand for dental hygienist. So you can either work as that, and dental technician, a proper dental technician. So these are the areas where you get the jobs too. And employment can be in either in a dental hospital, so in a private hospital or a big, you can see now there are so many corporate hospitals coming up, so you can work for them. Then dental colleges like Amrita or government dental colleges, if you write the exam and clear it, you will get a direct entry into the college lab as a college lab technician. Then there are so many multinational labs, dental labs in India and around. So you can work anywhere there with this degree. So the colleges, these are some of the colleges that have diploma in dental mechanics. And as you can see, the fee is little more affordable for Amrita. There are so many other institutes outside Kerala, but inside Kerala, this is one of the few institutes. And coming to the work and average pay scale, I have just given a rough idea of the pay scale if you work as a dental mechanics or technician, or if you work as a lab assistant. So it will come around 3 to 4 lakhs if you depending upon your experience and the quality of the work you do. That is mostly important in this field actually. More than theory, the practical knowledge and the hand skill of the person is more important, that you can definitely achieve within this 2 years of time period. And the areas of education, as I told, it is basically prosthetic work. That is, as I told you, the crowns, bridges, dentures, all that is what we do. Then orthodontic work like alignment correction and all. For that, we need some appliances and all that. We'll depend on the dental lab technician to do that. Then we have CAD/CAM ceramics. New technologies are coming up. So dentistry is like evolving so fast. We have fully digital things coming up now, and Amrita is a center for this digital excellence. So I will be dealing with that also in the coming slides. So these are, and then the basic things, or in the simple form, you can operate the dental equipments, because there are so many equipments involved in this production of these prostheses and all. So you can act as a operating officer also in this field. So prosthodontics, basically, it is, you have removable prosthodont, as I told you, the set teeth that you call it. Then you have fixed type implants, and the last picture shows nose, eyes, and ears. These are all fabricated here, and Amrita is the center. I'm proud to say that we have a good maxillofacial prosthetic clinic here, and we have a good set of faculties that they are doing all these jobs. So we have the people who join here have the opportunity to see and do all these works in person. It is not just pictures or future, it is being done here. You can inquire to any student who is studying here. They all have they all get the chance to do and work on this prosthesis, this complicated things also. So these are some of the orthodontic appliances that a dental technician has to make. Pedodontic appliance, that is for kids. These are the appliances. And then coming to our area, that is scope. What are the different scopes that you can achieve after this dental mechanics course? So as I told, you have large dental laboratories like Dencare. You must have heard of so many dental laboratories are coming up. Earlier, there weren't that much dental laboratories, but now there are so many dental laboratories. So you have a lot of work opportunity in all these. They are all in need of a proper a certified dental technician. That I would say that, because many people learn this from others and you do it, but when you go outside or when you go to a lab, your pay scale will be decided based on the certification. So Amrita is a certified college where you will get a proper certificate and degree. It is not like you like mouth recommendation. It is a certificate that you get for, it's a certified course. Wherever you go, you can confidently show it to any job areas. So then you can work as supervisors and managers of the dental labs. Depending on your seniority and experience, you can do that also, like supervisors, little more white collar job. Then you can work in corporate hospitals. As I told you, there are chains of hospitals now like Was and all that. So you can work in such hospitals, and private dental clinics are also there. Then government hospitals, as you know, government jobs are always special. So you can write an exam for that. If you get an entry, You can definitely work as a dental technician in government, any of the government dental colleges in Kerala and outside also. Then take up a teaching role. So dental colleges, for teaching dental technicians, you have some vacancies. So you can also come up as a teacher. Then you can set up an independent dental tech. If you like, if you are more of an entrepreneur, you can choose to set up an independent dental laboratory and you can make people work under you. So these are just the explanations for this increasing number of corporate hospitals, which I explained, the larger laboratories. And don't think that laboratories are just within Kerala. It is outside Kerala, outside India also. Even the lab I told you, Dencare lab, it has branches everywhere in UK, US, Canada, Australia, everywhere they have branches. So you can also try going out. So, and then supervisor manager roles, independent labs, dental colleges, government sector. You can write the Kerala PSC exams and then get into the government colleges also. So then we'll go ahead with the higher study options. So what after this 2 years? Do you have to stop with this diploma of 2 years? No, you have higher study options. The chief dental technician course is actually a 7-year course. Outside India, it is a chief dental technician. There's a course called chief dental technician, and that is actually a 7-year course. But if you are completed this diploma degree, you just have to take 3 years extra. You will get this CDT accreditation. Then you can, many children who are more interested, who get more interested in dentistry, sometimes go for even BDS after a diploma. So your hand skill will be very nice. If you think that you need to learn more and you're interested in learning more about BDS, you can go ahead with the BDS degree also. Then you can pursue a master in dental technology course in India or foreign universities. So that is also an option for higher studies. Then if you ask me why you have to choose Amrita, the answer was already told. This is a certified college. So you have this is a certified course. So wherever you go with the certificate of Amrita, you will be acknowledged as a dental technician. And the 2-year diploma course in dental mechanics started during the academic year 2010. This is a bit of a history. So 2010. So you know how many years now we have finished. It's almost 15 years done. And Amrita School of Dentistry is the first institution in the private sector in the state of Kerala to commence such a course with the approval of Dental Council of India. So this is what is the most important point in this. Dental Council of India, DCI, that is the main center or the main authority for all these BDS courses or whatever dental courses are there. So we have an approval from the DCI. So that is the highlight of this institution. And other universities have basics master level training only. It is very few institutes have this Dental Council India accredited course. So certificate is approved. And already the eligibility criteria, I have already told, it's a +2 with 55% aggregate mark. And if you have any changes, they'll correct it. Not less than, the age will be 17, not more than 23 years as on December 31st. And selection is based on the marks obtained in +2 and performance in the personal interview. They will have to, so how the admission process and all, I think ma'am will explain all that. So I don't have to, it's basically an interview process. You have to register yourself in the official website, fill the online application form, pay the application fee. The candidate will be shortlisted based on the scores secured in the +2 marks. Then they will, again, the shortlisted candidates will be called for a personal interview. So we'll have to check how much you are interested in this course. What is the motto behind you selecting this course? So all that we'll know with an interview, and then you can just go ahead with the final selection. Now coming to the syllabus. So how is this 2-year course? The course includes, as I told, both theory and laboratory sessions are there. So basic theory includes chemistry, physics, mechanics and all. So that is because you are more dealing, you're going to deal more with this materials than machines, and also you will have to know a bit of all these things, not too much, just the basics of all these things. Then a little about dentistry also, oral anatomy, dental mechanics, dental materials, metallurgy, all that. So because whatever you're dealing with, nothing is out of the syllabus or out of what you need. It is all it is all required for your base. And exclusive training in all the complex dental prosthetic work. So here we do all kinds of dental prosthetic works, and you will get training in all these things, the removable, fixed, implants, digital, everything. And this course usually comprises a year-end examination that includes, so in the first year and the final year and second year, we have university examinations, and in between we have some model exams also. So practical exams usually include not the exercise or the theory exam. We have a practical examination and viva also. So these are the subjects. First year dental mechanics, it includes applied physics, chemistry, mechanics, dental mechanics, and applied oral anatomy. Whereas the second year mainly will be more concentrating on the dental mechanics part. Okay, and the dental materials also, and you will get a basic knowledge of computers. So if you in case you go to a lab and you have to work both in the reception or in that computer related areas, or even in there are new technologies like computer aided manufacturing and designing of these processes. So for that also you need a basic knowledge of the computers. Sorry. So these are the training in practical works that you give. So complete denture, partial denture, these are all words which will be slightly above your level. So you just understand that these are the different types of prostheses that we will coach you how to make it. Okay. So coming to the department, faculty, and the lab infrastructure of Amrita. So when I talk about Amrita's course, I need to tell what all facilities you get here. That is very important. So we have a prosthodontics department, exclusively prosthodontics, along with we have so many subdivisions also. It includes this aesthetic clinic, that means the smile designing, all that is being done in one part. We have an implant clinic, so implant is done in our department itself. We don't have to go anywhere. We have an exclusive implant clinic. Then maxillofacial, as I told you, any facial defects or replacement of any facial structures, that is done in-house in our department itself. Sorry. So you can see the pictures of these people who have been rehabilitated in our department. There are so many patients coming up under, and we have our professor who is specialized in this. I'll show her photo and all. Then we have a temporomandibular joint clinic, that is any joint issues. These days, so many people are having this stress issues and all, and they are developing this joint pain and all. So for that also, we have our own treatment scenario and facilities here. So this is our department faculty, which is led by Dr. Manju V. She's a specialist, and I would say she's one of the renowned maxillofacial prosthodontist in India itself. So she has given so many, ma'am has given so many lectures, so many courses ma'am is taking. Still we are going on with the courses, and because of ma'am we have a full exclusive maxillofacial department. And other than that, we have many professors, senior lecturers, readers, and assistant professors in our department who are trained for all these. They have their own specialized areas, and I am also doing PhD. So like that, many people are doing specialization in their own areas. So this is the main area where we have the dental mechanics department. This is Mr. Vinod P. Nair, who is the chief dental technician with about 25 years of experience. I must say that he is the master of this dental mechanics course, and he's like an HOD of this mechanics course. So he will be teaching you everything. He's a very talented and excellent dental technician. So because of him only, this maxillofacial Dr. Manju is Dr. Manju's assistant in all the cases she is doing. So that is our strength of the dental mechanics department, and it has been running from 2010 now it is 2025. 12 to 14 batches have passed out. More than 100 dental technicians have been passed out. And this is our dental lab. So unlike other colleges, we have an exclusive lab division. So it is not only our department or patients PG clinic and all, we have a dental prosthodontic lab division for the dental mechanics students. And you have a working area, separate classrooms, separate working areas. Everything is exclusive for dental mechanics students. And this is known as the Chrome Cobalt lab or the dental technician preclinical lab. They have a preclinical and clinical lab also. So these are the equipments. It's a very fully equipped ceramic and all ceramic section is there. Induction casting facility is there. And we have a centralized suction unit. You can see all this. If you just come down here, you can see all these facilities. And latest dental technology dental. So we always take care that all the recent equipments that are there are installed in Amrita. So that is one of our highlights. So we keep it updated every day. And this is the highlight of this year. That is, we have started an Amrita Center for Excellence in Digital Dentistry. That means more than this handwork by the technicians, you can work on computers. So your effort will be less, but you have to gain more knowledge on computers. So everything is digital, everything is coming into digital. You are coming into an AI world. So artificial intelligence is coming up. So we are expecting everyone to have a coaching in that also. So in digital dentistry also, more than this handwork, along with that, after that, you can join here for the digital dentistry courses also. So we have inaugurated it. It is now fully fledged working, and we have a complete CAD/CAM system now. So all the departments are giving works, and we are doing the, and as you can see, it is all digital. So you don't have to put in too much effort and work day and night. It is just the computer's job, but you will have to. And Amrita is one of the few institutions where you get a training for that also. So wherever courses we have, we ask the dental technician students also to attend. So they also get a chance, more than they don't have to pay for any course and go outside and learn the courses. They have the in-house facility to learn the courses. We call people here and train them. So we have that facility also. This is the CAD/CAM area. The CAD/CAM unit is here. So if you learn this now, that is what is coming in next. In future is this CAD/CAM units, CAD/CAM crowns. CAD/CAM is the future. So if you learn, if you have seen this machine itself, you rarely get to see this machines in the normal labs you work. So when you have a machine, this cost you crores. So when you are getting a more exposure to all these works, you are being a part of this workflow. So when you go outside India or when you see this CAD/CAM machine, you're already using all this. So you don't have to get a special coaching in that. This is all done from Amrita itself. So these are the placements of our alumni. More are there to be added. So it's where they have outside Gulf countries, how our alumni have been posted or got jobs into. And even in Amrita, so many people get into Amrita itself. Then they go to private labs, corporate labs, UK, US, all that. We have students everywhere around the world. So this is just a video of one of the dental technicians who have passed out from here, and she has joined back in Amrita. So she's still working here. This is just a testimony of that for you to just listen to her.
ഞാൻ അമൃതയിൽ dental technician ആയിട്ട് വർക്ക് ചെയ്യുന്നു. ഞാൻ 2011 to 13 ബാച്ച് പാസ് ഔട്ട് ആയി. ഇതൊരു 2-year ഡിപ്ലോമ കോഴ്സ് ആണ്. ഈ ഒരു കോഴ്സിനെ കുറിച്ച് പറയുവാണെങ്കിൽ ഇതിൽ വളരെയധികം ടൂറിസ്റ്റ് ആയ വിദേശ രാജ്യങ്ങളിൽ ഒരുപാട് ടൂറിസ്റ്റ് ആയിട്ടുള്ള ഒരു കോഴ്സ് ആണത്. അതുപോലെ തന്നെ നമ്മുടെ കഴിവിനെ കൂടുതൽ എക്സ്പോസ് ചെയ്യാനായിട്ടുള്ള ഒരു മേഖല കൂടിയാണ്. ഈ ഒരു കോഴ്സിൽ ബേസിക് ആയിട്ടും ക്രൗൺസ് ആൻഡ് ബ്രിഡ്ജസ്, dentures, fabrications, orthodontic appliances, ഇതൊക്കെയാണ് ഇൻക്ലൂഡ് ചെയ്യുന്നത്. ഒരു ഡെന്റൽ മെക്കാനിക് ആയിട്ട് വർക്ക് ചെയ്യണമെങ്കിൽ ഡെന്റൽ കൗൺസ് രജിസ്ട്രേഷൻ നമുക്ക് വളരെ അത്യാവശ്യമാണ്. അതിനപ്പുറത്തെ ഈ കോഴ്സ് നമുക്ക് വളരെ അനുയോജ്യമാണ്. അതുകൂടാതെ തന്നെ ഡിജിറ്റൽ ഡെന്റിസ്ട്രിയിലും നമുക്ക് ഒരു ഡെന്റൽ മെക്കാനിക്കിന് ഇത് വളരെയധികം സ്കോപ്പ് ഉണ്ട്. എന്നെ സംബന്ധിച്ച് ഞാൻ അമൃതയിൽ വന്ന ഈ ഒരു കോഴ്സ് പഠിക്കുവാനും അതുപോലെ തന്നെ ഇവിടെ തന്നെ ഒരു സ്റ്റാഫ് ആയിട്ട് വർക്ക് ചെയ്യാനും സാധിച്ചതിൽ എനിക്ക് വളരെയധികം സന്തോഷമുണ്ട്. അതുപോലെ തന്നെ ലൈഫിലെ ഒരു ടേണിംഗ് പോയിന്റ് തന്നെയാണ് ഇത്. താങ്ക് യു.
So with this, I conclude, and I just want to say that for those who are actually in a confused state, I hope the confusion has been cleared, or those who have had apprehensions about this course, you are in the safe place. You don't have to worry about any accreditation issues. It's completely accredited, and you have, and the highlight is that not only the dental technicians, you get coachings from, or you get to learn from the dentist or the professors itself. You're not learning from any juniors or anybody. You are learning from the most experienced professors itself, that theory. And so your theory, every part of this course will be dealt with. So you will have a good theory, practical knowledge from the dental technicians guiding you. So it's a mix of everything. So you don't have to worry about anything, and the scope is guaranteed. So I think, ma'am, is this okay for today?
Yes, thank you so much, ma'am, for that informative and thought-provoking presentation. Anyway, may I just ask you a couple of questions, ma'am, like just to clear it for.
Sure.
Yeah, ma'am, the first one is there scope for graduates to establish their own dental laboratories or prosthetic manufacturing units?
Definitely. That is one of the areas. They can start clinics. They can start the laboratories by their own. They have a scope for that also. If they have investment, they are good with the investment part, they can definitely start with the lab.
Okay. And then, ma'am, this DDM qualified candidates, like their opportunities abroad, are there any specific countries like which show higher demand for them?
Mostly the areas where the lab is there. If you don't want to learn more, like even after BDS also, if you want to work in specific countries like US, UK and all, you will have to take one more degree. Like from their native degree is also required, right? So like that, the dental technician course also needs some degree. As I told you, that the number of years will be less. But in Gulf countries, you don't need any special degree for this. With your experience from here, you can go and work there. So because many of our students have been already posted in many of the labs in Gulf countries. Only in the other countries, you need some extra degrees, including this IELTS. Normal, every course has some requirements, right? It's the same requirements.
Okay, ma'am. Is there any higher education that they can go on after their diploma?
Yeah, that's what I told, that chief dental technician course is there. That is actually a 7-year course.
Okay.
After this course, they just have to spend 3 more years, extra years for that.
Okay. That's also nice to hear, ma'am. That would have been a motivating point to these attendees over here. We have almost all of them here today as the applications. Now, ma'am, another question is, are there 3D printing or CAD, CAM systems into the training of dental mechanics?
Yes, we have actually in that, as I told you, that digital dentistry includes 3D printing also.
Okay.
So we have already started the CAD/CAM and 3D printing. So they are getting exposed. So now almost 5-6 courses have been completed in CAD/CAM, and all are exclusively for the dental technician students.
Okay.
Because BDS people don't get that much exposure to these things. Mainly for the postgraduates and for the dental technicians. So they are so much, the batch now is very interested in all these things because they are into the digital world. So they are getting almost 5 courses are done, and we have still courses coming up also. So that is a rare chance to get, because otherwise we'll have to pay money and go outside and get the course done. So here we have the in-house facility with demonstration.
Okay.
So the highly qualified people are coming from the company, from other countries, states and all, to give the demonstration for them.
Okay. So do their hands-on start with the theory, or it's after the first sem or something like that?
No. It all starts together. First the basics, basic small things they start with, and then as they progress, they have in the first year itself they start doing the patient cases, because they just have 2 years. So we don't have time to wait for the theory to complete. It's all together.
Oh, okay. Thanks a lot, ma'am, for
Thank you.
all those information. If anyone has any doubts, you could please drop your doubts in the chat box. Meanwhile, before we wind up, madam, we have Shanley from the admissions team who will talk to us about the admission process for this academic year. Shanley.
Thank you, ma'am. I'm Shanley from Admission Office, Kochi. So we are here to discuss the admission procedure of Diploma in Dental Mechanics. As earlier Anna ma'am said, the duration of the course is 2 years. The eligibility is you have to secure minimum of 55% aggregate marks in physics, chemistry, biology, and English in your class 12. And age criteria is minimum you should be of 17 years of age and maximum of 23 years of age as on December 31st of each academic year. The selection to the course will be decided by a personal interview and also by seeing your class 12 marks. So we have two categories, scholarship category and non-scholarship category. The tuition fees in scholarship category is rupees 10,000 and in non-scholarship category is rupees 15,000. We have a first year other fees of rupees 33,590 and admission processing charges will be collected in the first year, which is of 2,500 and hostel and mess is 80,000. So just take note of this website. This is the admission website of Amrita, amrita.edu/admissions. And the second one is the Diploma in Dental Mechanics website. Already all the candidates have registered. Just note down the URL for the further reference. It is applyug.amrita.edu. So as you can see, this is the URL applyug.amrita.edu. Already most of them have registered. So those candidates can log in using their mail ID and password. And if you are willing to register newly, you can register using your name, mail ID and mobile number. So moving further, you have to fill up the personal information. Then Diploma in Dental Mechanics is available in Kochi Amrita campus. So to the left side, you have to select the campus and to the right pane, the course will be mentioned. There you have to apply. So you have to move further with the payment of rupees 550. And we have multiple payment options. And later in the academic details, you have to update your class 10th percentage, class 12 percentage, etc. If you are awaiting for your results, you can select the option awaiting. And once the result is published, just change it to published and you have to enter the marks of your physics, chemistry, biology and English marks and save and proceed to the next step. In the next step, you have to upload the documents. As of now, you can upload the available documents and later on when your class 12 results are declared, you can upload the 12 mark sheets also. So after the payment, the candidates will be receiving a mail from Amrita where it includes a registration number. So further, you have to take note of your registration number, your registered mail ID and password. You have to remember it. And if at all you have any admission related queries, you can contact these numbers. And please take note of this mail ID also. The interview most probably will be conducting the online interview in the month of June. So all the registered candidates will be getting a reminder email and reminder calls from Amrita. Thank you. And please take a note that the admission to the Amrita University, we have not appointed any third party or agents. So please be aware of that. Thank you.
Thank you, Shanley, for that detailed explanation. So, madam, I think it's time. We don't have any doubts. I don't see any doubts asked. So I think we could wind up the webinar. And to all the attendees, it was a pleasure having you all with us. And I'm especially grateful to Madam Dr. Serene ma'am, who has been here with us since the last 2 years. She's always ready to come and present her presentation to all of you. And this was so clear and crisp today. I'm so happy for that, ma'am. Thank you once again. So I think we could conclude the webinar for today and hope to see you all soon in the Amrita campus. Goodbye and take care.